Hi, this is Dr. Moolya from Unihealth Speciality Clinics, Kondapur, Hyderabad. So recently I had a patient who had got a positive pregnancy test, or she thought it was a positive pregnancy test. So what does a positive pregnancy test indicate? A urine positive pregnancy test. So in the urine positive pregnancy test, if you have two pink dark lines, it means it is positive. Yes. But what if you have only one pink dark line, or what if you have only a lightish color to the second line is very lightish pink? Does it mean it is a positive pregnancy test? Yes. If you have only one pink dark line, that is at the control part. So if you see a urine pregnancy kit, you will have two places. One is labeled as C and the other one is labeled as T. So C is the control, which should always be a dark pink line once you put your sample, and the other one is T, which means that is the test. That is the one we are more worried about. Okay. So if you have two dark pink lines, then yes, definitely it is a strong positive pregnancy test, and you have to consult the gynecologist to know further about the position and the chances of the pregnancy. Next, if you have a lightish pink line at the test part, so you have done your pregnancy test, you have done with the early morning sample. The best time is definitely the early morning sample. You have done it with an early morning 5 a.m., 6 a.m. sample of yours, and you have gotten only a light pinkish line. Should you worry? So what you do is wait for 3 days, do the test again with the early morning sample, and if you yet get it as a strong line or a lightish pink line, then you visit the nearby gynecologist and they will advise you on what to do further. So what do we do at such times? If it is yet a lightish pink line, we have to get a beta HCG to confirm whether it is pregnancy or not. So definitely if you have two pink lines, it means it is pregnant. So if you have a lightish pink line, do visit the gynecologist, and depending on that, they will do your blood test, that is a beta HCG hormone, and also they will further assess on when to get the scanning done and where to get it done. Next, if you have only one single pink line, that is either on the control part, that means it is a negative test. But does it mean it is really negative? Same rule applies. You again wait for 3 to 5 days, repeat it, dark pink line at the control part, that means it is a negative test. If you have only got a single line at the T part, that is the test part, and there is nothing at the control part, that means that is an invalid test, and you have to repeat it again with the same company or with a different brand, whichever you prefer. Now, yes, there are times when these urine pregnancy tests, they are giving false reports, whether it is false positive and false negative. So if you are not convinced with the test, please you get the serum beta HCG. You can yourself go visit a laboratory and you can get the serum beta HCG test done, which in turn will give you a clarity. And if, for example, your serum beta HCG test is positive, wait for 2 days, repeat it again after 48 hours, the same serum beta HCG test, preferably in the same lab and approximately around the same time. So we will know whether the value is doubling or not, and depending on that, we can assess whether you're pregnant, and if you're pregnant, if your pregnancy is in the intrauterine part or in the extrauterine part, which is also known as an ectopic pregnancy. For any more further queries or any more further doubts that you have that you want to clarify, you can anytime please feel free to visit your gynecologist nearby so they can give you more clarity on the further issue. Thank you.